Welcome to a special edition of Talk Ottawa. Today we're going to talk about the opioid crisis in our city. As you know, there have been some very high-profile cases that have provoked fear and attention. The mayor recently went to Queen's Park and asked for support from the provincial government. What are some of the potential solutions that we can bring to the table as a community? We're going to talk about that with several guests on the show today. We are joined by Jennifer Armstrong, who is a family therapist with the Dave Smith Centre, the Dave Smith Youth Treatment Centre. Sean O'Leary is a Canada father who is also the founder of WeTheParents.ca, who wrote a very powerful Facebook posting that brought a lot of people's attention to this issue. Also, we are joined by Andrew Mendez, who is Director of Operations for the Rideau Wood Addiction Centre, and Shalita Datani, who is a local pharmacist and mom, and someone who has also written about this subject. She is also Associate Director of Professional Development with the Canadian Pharmacists Association. Welcome to all of you, and thank you for joining us.
Thanks for having us.
And Sean, maybe you can go first and just share your story and how you got involved in this issue and how close to home it is for you.
Well, first off, my daughter has been struggling with addiction for a couple of years, and I had spent many nights and days running around trying to find her, as many parents have done before me and for generations. And then basically December 31st happened, and that's when a young gentleman overdosed or passed away in my garage, and then I performed CPR on him, and eventually the paramedics arrived and brought him back to life. And at that moment there, I realized that what I'd been hearing from other teens about overdosing was something that was more than what I thought it was. And when I'd seen Aiden in my garage on my arrival home, he was not breathing, he had no heartbeat, and his lips were blue. We were performing CPR. One of the girls that were at my house had phoned 911, so she had the operator on the phone. They helped me go through the motions of doing all the CPR. I'd taken it before from being a hockey coach, but probably 25 compressions on his chest in. I was like, I didn't think he was coming back. At around 50, he sort of gurgled, and we got a breath out of him, and he started breathing a bit. We put him on his side. He stopped again. No heartbeat. We started CPR again, and the paramedics arrived. They injected him with Naloxone, and he came back to life. And I was sitting there after everyone had cleared out, and I was by myself as the clock hit midnight, sitting at my kitchen table, and I was going, what is going on? And I knew then that we had a huge problem. And then the next day I heard that Tess had passed away, and I knew these kids were all doing it, and I started running around trying to figure out what to do to keep my daughter safe, her friends safe, and
you organized a meeting with other parents,
yeah.
So and you had to change the venue because so many people wanted to be at the meeting. So tell me what happened there.
Well, originally I was hoping to get 12 to 15 of Paige's friends' parents to meet at my store on a Thursday evening, and I wrote, originally it was not a Facebook post, it was an email. It was actually, I counted yesterday, 21 people. And one of them, a buddy of mine, Dave Ross, phoned me and said, can I post this on Facebook? And I said, well, I said open letter when I sent the email, so I said, I guess so. And he put it on Facebook, and that was that. And the next morning I woke up and my phone was like full of messages and emails and texts asking about confirming that I wrote it, and right. So they could repost it. So I put it on my own Facebook, and the response was, well, nothing short of phenomenal. Like, yeah. I had a couple hundred people came to our first meeting. We had moved it to KRC, and that, of those 200, it was all families with children that were struggling with addiction. I asked for no politicians. I asked for people that didn't have kids that were struggling not to come, because I was getting so much response. I wanted to keep it to just families with children struggling, and I was shocked by the numbers.
All right. Jennifer, how different is this problem from the other times when we've been grappling with drug addiction issues and with overdoses in our community?
So I think that the difference is that we're dealing with fentanyl, right? And we're dealing with a drug that causes people to overdose so quickly. And it's a really powerful, addictive drug. And in the hands of kids, it's blowing their minds. So they're struggling, and people are getting addicted much faster and much more readily than they were potentially with other substances in
right.
the past.
And then there's the added element that that they might be taking a drug and thinking it has a certain potency, and in fact it's much more powerful than that, and they're overdosing instantly, right?
Yeah, and so the reality is they don't necessarily know what they're taking, right? So they think that they're taking something, right? Some pill, and perhaps maybe we can use the example of Percocets.
Yeah.
And they think that they're taking Percocet, but unfortunately, we all know that people who deal substances don't necessarily regulate their product, and some of it's being cut with fentanyl, and they don't even realize that they're taking this substance. They think that they're taking something else.
Yeah. So Andrew, how differently do we need to approach the problem then, if it is a different problem from what we've encountered before?
Well, thank you for having us here and to discuss this issue. And again, I want to thank Sean for having brought up the urgency of us as community providers and community to come together and increase the efforts in promoting the measures that are available now to our communities and to reduce overdose and especially to reduce fatal overdoses. Fentanyl is not a new substance. It's been around for decades, but prevalent in Ottawa in the last 5 to sort of 8 years. It began being abused through patches, where people were having access to patches and cutting them and very not being able to control the amounts. And of course, these are usually people that are addicted to opiates that would go in and resort to using these patches that are used mostly for palliative care. Now, what has changed more recently is in the access and availability of it. That it's changed, and now it's coming through in powder form, in pill form, in pills that are being laced with it. So the impact here that brought this case to light now is that it's impacting youth that are taking it unknowingly, and of course, the risks of doing that increase the opiate risks of overdose, 50, in this case, 50-fold. So in terms of interventions of what's available, of course, there's many different, there's many gaps currently, and those have been identified province-wide. But in terms of what the communities can be doing along with families and parents and so on, it's firstly start, disseminating a lot of the information that's out there and being able to have this process begun and being sort of expedited, and the speed of it has just increased with Sean coming forward and these cases coming forward, and we're really seeing a rapid dissemination of information to assure safety, but surely there's a lot more work for us to do.
Right. Shalita, you wrote something about this. You gave a lot of good advice to parents, and we can walk through some of that. And you brought a Naloxone kit, which we can explain about in a minute, and even
Sure.
you can tell us more about it. But do you feel like there are times when we're addressing a problem like this and trying to fix it long term and try to steer kids away from taking drugs and so on? When I see people talking about a solution like the Naloxone kit, it feels like the first step that we're taking here is just to deal with the urgent reality of the situation when somebody overdoses. It feels like that's the first thing that we need to do as a community, is not, obviously there are all those other things that we have to address as well, but step one is to be in a position where there are more of these kits around, right?
Sure, absolutely. And I guess as a pharmacist and as a mother, harm reduction is really an important tenet that I try to remember. And naloxone is this is a complicated problem with not one solution. Naloxone, many will say, is a Band-Aid, but it's a life-saving Band-Aid, and we should have access, I think, everywhere. Over the last year, pharmacists across the country and pharmacies have been able to provide naloxone to patients without a prescription. It is amazing to me, and part of the reason that I engaged in this conversation with friends and then later a little bit on social media, it is amazing to me how few people understood and realized that they could go to their local pharmacy and get naloxone. I'm really happy to say that over the last, week, Ottawa Public Health here locally has published a list of, 87 pharmacies that now carry it. I think there's an impetus to have naloxone everywhere, accessible. It's a very safe drug. Again, a Band-Aid, but a life-saving Band-Aid. So I believe that everyone should have it in their home.
Okay, so you're saying every home should have some naloxone?
I believe so. Just like you would have a carbon monoxide detector or a fire extinguisher, or maybe even wear a seatbelt. You hope you never have to use it, but if you do, you could potentially save a life. I think that can't be overemphasized.
Right. So can you just walk through what it is and what it does?
Sure. So naloxone is basically just a temporary antidote that reverses the effects of opioids, and it doesn't last very long. It lasts about 30 minutes. So in a kit you get, and I can just show you, you get 2 ampules of naloxone. So if you are actually needing to administer it to someone, you may need to give 2 doses because again its effects only last about 30 minutes. So you inject it, you give it to someone, you wait about 5 minutes. If you don't see a response, you can administer a second dose. What it's really doing is it's just buying time for you until you have emergency response services arriving and taking care of the individual who's been affected. But it does reverse the real toxic effects of opioid overdose, like respiratory depression or stopping breathing. So it's an actual antidote to the opioid that you're taking.
Okay. And is it easy to administer? Because when you start talking about every home having one, I think a lot of people are feeling like, okay, I can have this thing here, but will I be able to do it in that moment of crisis?
Well, I mean, I'm not going to sugarcoat it because you do have to, just like you get a flu shot in your arm, you do have to inject naloxone. So it's as I showed you before, it's a glass ampule. You do have to take a syringe, withdraw the liquid, and then inject it into someone's arm or leg. Now, you may be nervous, you may be standing beside a friend and you don't know what they've taken and you're not even sure and your hands may be shaking. But again, we just try to alert patients and folks out there that this is an emergency life-saving therapy. Grab a friend. If you need help opening up the ampule, have someone beside you to help you. You can't really hurt anyone by giving them this drug, but again, I can't emphasize enough, you could save a life. So I think some people get a little bit skittish about having to give an injection. It's probably the best and most accessible formulation of naloxone we have now. We do have an intranasal formulation available as well that I have here that you can squirt into someone's nose.
So this is like a nasal spray of naloxone?
Just spray into someone's nose, and it essentially it gives it's not as well absorbed as the injection, so it comes at 10 times the dose, but it's much easier to administer. Now this still comes at a fairly significant cost, and across the country still is not paid for. In Ontario, naloxone is covered by the Ministry of Health, so it's available free to people. But this, hopefully, within the next 6 months to a year, will be much more accessible and hopefully at a much lesser charge. So this is coming, but right now the injection is what we have.
Right. And again, you can't hurt somebody with naloxone. It doesn't cause any side effects. It doesn't pose a risk to anybody.
Naloxone is safer than aspirin. It's a very safe Band-Aid. The only effects you may see is someone experiencing withdrawal symptoms. So if you're giving them an injection of an antidote, they may wake up angry, they may vomit, they may have some effects of withdrawal, but those don't come from the naloxone itself. It's just because you're experiencing some withdrawal.
And Sean, do you think that's the most important step we can take right now, is to have these kits everywhere?
Well, I think it's there's many steps to make, but that one obviously is very, very important. And I think since we started, since my letter went out, I know we've hundreds of them, if not thousands, have been given out in this city. So I think yes, it's the first step to make sure the kids that are out there and the young people that are addicted, if they do go into overdose, that there's the antidote is out there and available wherever they are.
Right. But I mean, that's really dealing with it on the front line of the crisis, obviously, right? Jennifer, this is not a long-term solution. That's acknowledging the fact that there are going to be people overdosing, and we need to be prepared for that.
So ultimately, at the end of the day, we need to look at the 4 places where we need to put funding, right? So harm reduction, which is what naloxone is, it's a harm reduction portion, but we also need to look in enforcement and treatment. So it's one piece. It's a really important, good piece, but at the end of the day, we have lots of other pieces that really absolutely need to be paid attention to, and prevention and treatment are definitely ones that we really need to look at.
Yeah, so let's look at those. And from a treatment perspective, I know that there are some people who are concerned about whether we have enough resources in our community to handle the number of people who might be seeking treatment. What's your sense of that?
So ultimately, at the end of the day, all of addiction treatment is chronically underfunded. It's every single agency in the city. It has wait lists, has a need for funding in order to provide better services. So at the end of the day, we all need money, because a wait list means that there's somebody waiting, and there's somebody who could potentially be engaging in treatment that isn't getting it because we don't have enough space for them.
Okay. Andrew, what do you think about that? What can we do to improve the availability of treatment in our community?
Well, that is one of the top priorities currently of the local health integration networks, is to improve availability and access. Now, those are very loaded words, and of course, organizations, as Jennifer was mentioning, are always striving to be able to widen their doors and be able to admit clients at a faster rate. And as we're also addressing the issue, and specifically to use, which is what brings us here today. It's about really being able to increase immediate access to services. It's no different than what's happening with the adult population. There is no immediate access to services, but I think with use, there's also the possibility to at a community level and at an organization level to work around identifying high-risk use, and then be able to have services immediately available. Of course, this is.
So is that not the case now? I mean, if somebody presents themselves now and says, and obviously it does start with this, somebody wanting to get treatment. You can't force people into treatment and have that be successful. But if somebody presents themselves and says, I want treatment, is there treatment available for that person?
Now, let me put a little bit of context in terms of treatment. And treatment has many different phases, right? And treatment looks very differently at very different stages of someone's progression throughout addiction. And having available access to treatment at times could mean that having the first access to an addiction counselor. That doesn't mean that this person is going to stop or reduce their use, but that engagement that starts happening with a counselor to then support them through this journey. Right. There's an idea that if there is treatment immediately available, that addiction is going to be stopped and seized, and we need to have be very mindful that treatment for someone who experiences substance use dependence will be a process.
Yeah.
Right.
And a long process in many cases.
It can be a long process, and it's not defined how long that is for each individual, and it's not only treatment that plays key factors within the success of someone's recovery, right? It is evident that family support, better financial situation and support, along with immediate treatment, has the higher predictors and best outcomes. So it's really great that Sean is bringing this forward, because this isn't only about treatment, it's about community, it's about the whole community being able to address this, and of course increasing access to services is a big piece.
Okay. Yes. So Sean, let's bring it back to your story and your family story, because I remember speaking to you about this before, and one of the things that really stood out for me is that there are times when you talk to your daughter and she really wants to end her addiction and deal with it, but you portrayed it as though, depending on the day, you're living with two different people, right?
Well, yeah, I think the children are struggling with it, and I think like anyone that's addicted to something, there's a part of them that doesn't want to be that. And when you're dealing with Paige, who's a little girl that I grew up loving and everything, she doesn't want to be, but there's that other part of her which is struggling with the addiction to fentanyl, that wants it so bad that you have to try to divide the two yourself to know which side of her that you're dealing with. Does she want to get better? Yes, but all the kids do, but they're struggling. It's as I mentioned earlier, it's one of the most highly addictive drugs that have come into the illicit market, and they struggle with it. And as I was saying earlier about dealing with the young people, we have to start as a community dealing below, just not with the people struggling with addiction, but the ones coming up, because the only way this system is ever going to start being fixed is if, as a society, we start producing less addicts. Because if at the bottom end we can produce less into it, maybe the services that are available can help the people that are struggling. But if we keep producing them as a society, because as I say in a lot of my talks now, it's not just about addiction recovery, it's social recovery. And we need to start engaging with these people when they're younger, before they've started doing the drugs. And because I think part of this happens is they hit that sort of 13, 14-year-old age. They don't feel they quite fit in, and they find other ones, kids like them. And then we do things like in Canada, build them $1.5 million skateboard parks, and we basically stick them there, and they do their stuff, and nobody engages with them. And eventually they say, screw it, we're going to engage with each other, and we'll do it with drugs or however we want, because nobody cares about us and we don't care about them. And they become this group. And I think as a society, we have to start engaging with the young children and with the people that are struggling with addiction, get rid of the shame and the stigma, because as a society, if we can start engaging with them like we've done with many other people who have struggled with different things, I think that's the only way we're going to beat it. Because if we rely on the Dave Smiths or the Rita Woods to fix everybody coming up into them, in the end, we see the results. There's too many kids. There's waiting lists for both of them. For everybody in the city, there's a waiting list. So we have to engage these children, have less, try to produce less people struggling with it, and then hopefully, if we produce less, we can start dealing with the ones that have fallen through the cracks and are struggling with the addiction. Because we're in a new era now that's never in the past been, where there's been many parents like me that have ran around after their kids and tried to keep it quiet because of the shame and the stigma.
Right.
But as I've said, on December 31st, that changed in my life, and it changed in the city of Ottawa's life, because at that point there, our children started dying, and it continued on into February, and we're here now, and it's not gonna, the criminals that are supplying these drugs to our children are not gonna stop because we as parents are scared or don't want them to anymore, because they'll just continue on. And so I think as a society level, as parents, everyone in the community has to work at solving this problem, because if we keep it still as the shame and the stigma and under the carpet, we'll be here 5 years from now talking about how many kids are dying and what are we going to do to fix this problem, and we'll be in the same boat.
So Shalita, let's talk about some of the advice that you have for other parents. Maybe you can walk through, because I think a lot of people are feeling very powerless right now, so the good information would help.
Sure. And again, as others have said, I just want to echo that the real heroes in this are folks like Sean, who have come out and talked about destigmatizing this, and been brave enough to talk about his own story. I certainly, as this hit my backyard, I've worked as a pharmacist for over 20 years, thinking about the risks and benefits of opioids and talking to patients and physicians about them, and all of a sudden it lands in my backyard, and I get a phone call at work on Valentine's Day, and a girl in my daughter's school has passed away. Somebody who she traded compliments with in the hallway has died, and my husband asked me to come home, and I came home, and I really felt powerless, as you say, as I think many parents do. And over the next couple of days, I didn't say a lot except comfort my kids. And then as I started to talk to friends and neighbors, I realized, as I suggested earlier on when we were talking, that so many parents really don't know how to start the conversation. And sometimes, and I'm just speaking as, my role as a parent to try to educate and inform as part of harm reduction. You're tempted to react, and you're tempted to, and again, I'm not a therapist, I'm just sort of speaking from the heart, and you're tempted to use emotion to sort of guide your children and say, you should never do this. But I decided I couldn't do that, so I felt that I had to use some of the knowledge that I have as a healthcare professional to start conversations. And so I wrote a piece, and it, I think, did resonate with a lot of people in the community. And I started just talking about things like, what are counterfeit medications? Let's talk about that. And what are the risks, as you have suggested. We seem to have kids who now are feeling not uncomfortable taking a pill, because that Percocet that they may have been passed in the hallway looks just like what they got for their hockey injury last year. So they take it not realizing that it could have, and it has indeed been laced with fentanyl, which is 100 times more potent than morphine. And the girl that was affected in February was probably 90 pounds soaking wet, and it's just horrifying, the uncertainty. So I call it Russian roulette. And then the other thing that I talk to parents about is, I think people don't realize, is that yes, we know that our kids are exposed to illicit drugs at parties and at school, but there's a statistic I read recently that suggested that up to 2/3 of kids access their first opioid from a legitimate prescription that they have found in the home, because maybe a grandmother has cancer and has left her morphine out on the kitchen counter, or a dad has had hip surgery and has his OxyContin on the bathroom sink. And it's kids, especially adolescents, are interested in experimenting, and the temptation is there. So really talking to parents and teens, as I did in my post, about the importance of really safely storing opioids, which I do in daily conversations at the pharmacy counter. When I talk to patients, I talk to them about storage and returning medications back to pharmacies. It's just amazing if you ask a group of 10 people how much leftover medication they have in their house that they don't use anymore. I'm sure that 9 out of 10, including myself, would say, yeah, I have something left over in my house, an antibiotic that I didn't finish or whatever. But with opioids, you're talking about a completely different story. So we try to talk about those things, and then the sort of realization that naloxone, as we talked about earlier on, is really safe, and although it's not the answer to a very complex problem, it is just one potential chance to offer something in the harm reduction strategy. So encouraging people to realize that this is a huge problem now.
Just one thing to say on that, Mark. And I wrote my letter, my email on the Friday. It wasn't until the following Wednesday when a light bulb went off in my head that I went, holy crap, my daughter's addicted to fentanyl, not to perks, because when I heard perks, I was on studying like what's in them, and the perks that the kids were getting had nothing to do with what the Percocets that are sold by our pharmacies by prescription. Those are made with Oxy and I believe Tylenol, and the counterfeit ones are antihistamine and fentanyl. They have nothing the same other than they stamp it with Percocet because they like the name, and the name Perk sounds good to the kids, and it's just a marketing tool, because all it really is a delivery vessel for fentanyl.
Right.
And it was 5 days before I realized that my daughter was not addicted to opioids, just opioids, but of all of them, the worst one, fentanyl.
Yeah, we don't have a lot of time left, but Andrew, did you have any other advice for parents very quickly?
Well, for parents, I just want to echo really opening conversation and talking on a regular basis with your youth, teen, child about substances, and that education starts early, and it also starts early through the family presence and family involvement in the youth's life. Like Sean was mentioning, being present in your child's life is crucial. It's crucial to develop that connection and that relationship that when they start branching out to their peers, that they still continue having a very strong support at home to be able to have open conversations. Yeah.
Okay, we're going to have to stop there, but Shalita, Andrew, Jennifer, Sean, thank you very much for sharing your thoughts today. I appreciate it.
Thank you.
And that's it for this special edition of Talk Ottawa. Thank you very much for joining us.